I'm Dr. Dominik Meyer. I'm a podiatrist with Franciscan Physician Network. So I decided to pursue medicine because I like to influence people's lives. I like to be able to help people when they're at their best, when they're at their worst. My mother's a nurse, and so I did grow up a little bit in medicine, and it's always been something that I've been very interested in. So when I was in college, I was really interested in sports medicine and orthopedics, and spent some time with some orthopedic surgeons in the Chicagoland area. Really enjoyed the surgical aspect of it, but felt like a lot of times they weren't getting to spend enough time with their patients. I enjoy podiatry because it lets me kind of influence every aspect of someone's foot and ankle health. I get to do surgery, but I also get to spend time with patients, whether it's in wound care or just routine nail care treatments. So my philosophy of care was sort of instilled by me by several mentors throughout my early career, and that is just to treat everyone as if they were a family member. Again, people are coming to you in their best of times and their worst of times, and having that relationship between provider and patient I think is very important. So I have a great interest in diabetic foot care and diabetic wound care. It can be very rewarding and very frustrating, and it's a constant challenge for me. But I find that patients, when they're coming in with those level of concerns and issues, you can really impact their lives on a daily basis. So potential patients who are coming to see me, I want them to know that I'm going to do my best for them every day. My main focus and priority when I'm in the clinic is providing excellent patient care, and I strive to do that on a daily basis. So that's the thing I love most about podiatry, is that we are not just dealing with the bones, not just dealing with the muscles, we're dealing with everything when it comes to foot health. We are well trained in aspects of dermatology, orthopedics, all sorts of things that we can help to benefit a patient when it comes to their foot and ankle care. So outside of work, my primary focus is on my kids. I have 3 children. And so a lot of my time is spent going to different activities, especially with my boys. Their sports activities are really starting to become increasingly a part of our lives. In addition to that, my wife and I both enjoy playing golf. It gets us outside, a little bit of sort of that old athlete in me, where I do still enjoy that as well. So the main piece of advice that I like to give my patients is to think about your feet before you need to think about your feet. People don't really think about their feet on a daily basis, whether it's little aches and pains or changes to skin and nails. And the sooner those things can be treated, oftentimes the sooner they'll start to get better. And so paying attention to your feet before you need to, I think, is a huge benefit to patients.